everybody, welcome to Hoffman Oncology. Welcome back. Dr. Hoffman, welcome. Welcome to California.
Welcome to California.
We are going to post some hard science videos, and then now we were having a dinner conversation, and we were discussing kindness and empathy when it comes to doctors, particularly oncologists, because you're dealing with life events, right? You have some interesting takes on this. What are your thoughts on this whole concept?
Well, one of the things we happened last week, we were running this clinical trial on immunotherapy for patients with gastric cancer. And about a couple of months ago, we saw a patient that had come from a well-known institution who was told on a Wednesday at face, just like that, David, go home, and because you will be dead by Sunday. And
an oncologist told him
this, and the patient found his way to Dr. Bruckner, for instance,
who you see on this channel as well. Yeah.
And surprisingly, he not only did not die, but he was able to overcome the acute episode. His cancer is much better. Now, 6 weeks later, he's able to enter this clinical trial. They were doing gastric cancer with immunotherapy. And the question, the reaction, that I get a number of reactions, but the first reaction is, why would a physician say such a thing to a patient who is already weak and to the family? If, whether it's true or not, there is no benefit from it, except for perhaps robbing that person of any hope that's left, that possibly, that ray, that little thing.
But why? Is it to make their jobs easier, or?
Well, it could be a defense mechanism that people, unfortunately, we have a difficult profession. I mean, it's hard. There is a lot of stress, a lot of burnout, and sometimes the doctors put up a wall to prevent from being too involved. Or it could be that the physicians have changed over the years, and that sense of contact, of caring, because you can care without having to internalize another person's pain. I think psychiatrists do that all the time.
Yeah.
Right. I mean, so there is a way to do that, and I think perhaps the doctors have become more of a technocrats. There are guidelines, there are restrictions from insurances. There is the hospitals don't want to take patients who are too sick to die in the hospital. They prefer them to die at home. It's too costly. And there are a number of reasons. It's not that the doctor is a bad person. It's possible society has changed also. We don't want to face that.
Could be a number of things. Regardless of what it is, we have patients watching. So I think, in my opinion, the take-home message is you can't give up hope, and there's more than one doctor out there as far as oncologists are concerned. Always get another opinion. If you, do you think it's ever appropriate for an oncologist to let somebody know these kind of things?
I think that there are situations where you you may need to do that, just because of the fact that there are practical things that involve, depending on the family structure, and this is, obviously, you need to get to know the patient well enough that you can understand where they're holding psychologically, socially. So there are situations where that may be appropriate. There are situations, for instance, where it may be appropriate to go into hospice care inside inpatient. We were talking about before, in the Bronx there is a wonderful inpatient facility like that, or it may be appropriate to have hospice care at home. But there are ways to communicate that to a patient in a way that it becomes that you are making the decisions with them, first of all, and that they feel that that this is going to be almost like a cure. You know, it's at this point, you know, there is a way to present that in a way that it makes sense to the patient. It's not a threat.
So let's pretend you're a patient. What do you do? You're a cancer patient. Let's pretend, okay? What advice do you have to someone? How do they select their oncologist?
Yeah.
What criteria do they look for?
That's very tricky because patients select where they get their cancer care based on mostly on brand recognition, right? So if they are in the Midwest, they go to MD Anderson Cancer Center. If they are on the East Coast, they go either to Memorial or one of the places in
Brand,
the South.
prestigious.
Yeah.
Prestigious.
Brand is a very big thing for patients.
Get a question from the peanut gallery?
Huh?
Question from the peanut gallery?
Yeah.
So if it's an HMO, don't they often determine who your treatment is?
So there are unfortunately insurances that they don't have a choice to go to a certain particular place.
They can't make a choice, right?
There are a number, there are a lot of active groups or people who try to help patients make the right choices, and I think brand is not necessarily always the right choice. It's sometimes you have to find somebody that you can really, just like you would any other doctor. There is a knowledge, there is a skill, but there has to be something you can build up a relationship. Because if in fact this is an illness that will not come through in a good outcome, that physician may be the person who takes care of you. And takes care of you in many ways, and is going to be with you. It's not going to abandon you off the way in the care of a delegation. It's somebody that he delegates to, like could be a social worker, without getting into, or somebody else like a hospice, right? So, so I think it depends. Also depends on the stages of the cancer and how sick are the patients. But the brand is not necessarily the best quality of a physician. At least it shouldn't be.
What do you think some of those are? Just a handful of things you would look for if you were a patient.
I think when you meet, there is a thing called affinity people, right? You meet a person and you develop an affinity for that person. As a patient, you can develop an affinity for a physician in the first 25 minutes that you meet them, and that is a way that you can immediately tell.
So it's subjective, but you can feel it.
Subjective, and you can get a sense of their scientific knowledge, or it depends. For certain things, you need a very specialized doctor. For certain things, you don't need such a specialized doctor. But affinity is a big thing. So even when you go, for instance, for surgery, you have to have a feeling, an affinity for the surgeon who's doing surgery for you, because you're letting this person into you. You're becoming. There is an exchange, a deep exchange, and you want to be able to relate to that person. Again, obviously with skills, but even without skills. I've seen patients who go for surgery, and maybe not to the biggest name doctors, but they were doctors who were very caring. The outcome was the same, and the patient was very happy. And every once in a while you get a very good brand name doctor who is also a very nice person. Doesn't happen often.
So
Not often. Huh?
not often, not easy.
But we are now in the time where a patient should be looking, most importantly, the most important thing is to look for not innovation. We are at a stage at that cracking point where innovation is going to change the way we look at medicine, whether it's immunotherapy, targeted therapy, personalized medicine. This is how we're going to the future. That's the future. And so a place where innovation occurs, that's important. The physician that understands that there is enough information out there to introduce novelty in their treatment, especially in cancer, where there are so many drugs and there are so many options for treatment. Even for diseases that have never had treatments, like fibrosarcoma or liposarcoma, these very difficult to treat diseases.
More research is done on cancer than anything combined every year.
Every year,
Yeah.
every year. And so that's very important.
Basically become informed and empowered as a patient using the internet and then
Exactly.
using that knowledge that's out
Exactly.
there, right? Clinicaltrials.gov, fantastic. Now they post results.
100%. They right. That's right.
Okay.
Thank
Thank you very much, Dr.
Thank
Hoffman.
you.
We'll have more interviews, and hopefully if anybody has any questions, you can reach out and we'll get back to you. Take care.
Thank you very much. Bye bye.